Hello and welcome to Everyday Medicine. I'm Dr. Luke and I'd like to thank you for joining me on this podcast series where we share conversations with colleagues, exploring their special interests in medicine and bringing insights, ideas and advice which I hope will be applicable from medical practices. In this episode, we're talking with an expert on functional breathing, how to maximise one's potential through advanced breathing techniques. Well, before starting this interesting conversation, for Australian audiences, listening does give eligibility for your CPD, so log in and add this as an activity. You may also consider journaling, reflection, and adding to the review and performance section in your CPD. Well, in an earlier episode entitled Breathing for Performance, we had the privilege to explore healthy breathing patterns and the Bohr effect, which governs oxygen delivery to tissues, with physiotherapist and breathing expert Allan Abbott. If you haven't had an opportunity to listen to that podcast, I recommend it as an introduction to the subject we're covering today. Allan has been exploring breathing techniques to enhance exercise performance and improved health for many years and has created the dynamic company called Health Innovations that can be found at healthinnovations.net.au in order to bring this important knowledge into the public forum. Although most of us pay little attention to breathing technique in our busy world, many cultures and alternative health practices such as yoga and Ayurveda have focused on this for centuries, and the recent excellent book, Breath, by James Nestor, explores the importance of breathing technique in detail, including the influence on facial structure and disease brought about by mouth breathing and poor execution of this seemingly automatic task. Well, Allan takes us further in this podcast episode, in which we explore functional breathing, breathing during exercise, and how we can utilize breathing techniques to replicate high altitude training at sea level to improve performance and stamina in ways you may not have considered possible. Well, Allan was generous enough to give up a good deal of his spare time taking me on a deep dive through these breath training techniques one-on-one. We focus first on nasal breathing, light, slow and deep, utilizing the diaphragm rather than purely chest muscles, and aiming for a 4-second nasal inhalation followed by a slow nasal exhalation over 6 seconds. This develops the habit of 6 breaths per minute. We then worked on the breath oxygen level test, the so-called BOLT, with the objective of building carbon dioxide tolerance to reduce the gassing out feeling that can occur when one trains at a moderate exercise intensity. And subsequently, Allan took me to altitude with some strong breath holds during exercise, simulating the reduced partial pressure of oxygen experienced as we venture 2,000 metres above sea level and more, slowly resetting central CO2 chemoreceptors, increasing our hematocrit, erythropoietin and 2,3 DPG levels, as well as enhancing myoglobin production, mitochondrial density and cardiac output. Well, Allan is meticulous about this training and on establishing correct technique, noting that this would not be appropriate for those with advanced lung disease. I really enjoyed learning from him and have implemented these exercises into my daily routine. I hope this conversation will pique your interest as it did mine as we share the art of functional breathing. Now, please welcome Allan to the conversation. Allan Abbott, thank you and welcome back to Everyday Medicine, Allan. You're the Director of Health Innovations. You're an expert in breathing, expert in sleeping, general great guy, got some beautiful dogs. You're into sport. You've taught me how to breathe properly, and it's changing the way I view the world, Allan. So I wanted to share this on this podcast. I really do appreciate you making the time to come tonight. And yes, we are going to have a crayfish lunch at some point. To thank you so much for your efforts. Now, I want to ask you, Allan, why breathing? And we're going to just cover some of the things we have talked about before, but why breathing? Let's go through this again.
Why breathing? Because it's life-changing. Because
certainly helpful, useful.
Very useful. First thing you do and last thing you do.
Yes.
So why do we get it wrong in the middle? It's a good question. And plenty of people do. So through working, I sort of come to the conclusion that the pillars of good health are exercise, diet, sleep and mindfulness.
Yes.
So, I was charging along that path. And doing a bit of work in sleep and all that sort of stuff. And probably 10 or 12 years ago, I read an ad about breathing.
Yes.
And I investigated it and all that sort of stuff. And I thought this thing may have plenty to offer, particularly with the link to sleeping.
Yes.
Because if the classic would be snoring and sleep apnea.
Yeah.
So I thought, well, that'll tie in with what I'm doing. So I did a first course with a lady from Canberra who ran a breathing clinic for about 30 years, Tess Graham, and we did all covered stuff for sleep, but also functional breathing. And what I discovered was that statistically probably 50% of the population have a breathing pattern disorder, which means if you're sitting in the hospital, 1 in every second person that comes through the door, on average, look at a car going past, 2 people in it, on average, 1 will have a breathing pattern disorder on a spectrum from really bad to only minor, but yeah, it's out there.
Looking at me, would you say I've got a breathing pattern disorder?
We know, don't we, Luke, from what we did? We won't reveal your test results.
So, were they because they were so good?
Well,
I've certainly got
if you take comfort in that, please do.
Certainly got a thinking disorder, haven't I?
Yeah.
Belief disorder. No, that's very. Very big.
So we can change state very, very easily just by altering our breathing.
You know, this is not taught in medical school,
It's not.
And I think James Nestor talks about this in his book Breathe, and it's probably he talks about training that's happened in the past in American hospitals and how it has really made a difference to the management of COAD and asthma with a lot of people over the years. But it's not taught, and that's a shame, which is why we're having this discussion. We want to raise awareness.
Yeah. Well, when I did the physio course, we did cardiothoracic, of course, and definitely about breathing, but more treating, you know, the COPDs and pre and post ops and all that sort of stuff. There was none of this.
No.
Right?
Not about breathing technique.
No, and general everyday breathing, which is affecting a lot of people and affecting their health and lifestyle. But the other interesting thing is, I think now it's gaining momentum, right? Before it was on the back burner, really. But I think one of the things that's helped is the internet. So it's more, you can see it more. There's more podcasts, there's more YouTubes, all that sort of stuff. And I think that's helping. There's a guy called Patrick McKeown who started Oxygen Advantage, and we'll talk about that too. Patrick talks about he's been doing this for 25 years, and a lot of it was flying under the radar, wasn't doing much. But now I get the feeling, because, you know, we get on Zoom a lot and all that sort of stuff with a lot of the instructors, and if you've body surfed or surfed, you're sitting waiting for a wave, and then it's coming, so you turn and start to move to catch the wave. And you get that little bit of a suck in to start, and then the wave picks you up and you're on the wave and you feel that power behind you. That's what I reckon happening to breathing at the moment. It's just starting to get onto the wave, and I think we'll see it blossom.
A wave of awareness.
Yeah.
What is a breathing pattern disorder? Like, how do we sort of spot it? How do we assess it? Take us through that.
Well,
because we might see it, you know, as a clinician might see it in their practice. Might be someone comes in who's got a emphysema or asthma or some other breathing disorder, and they may think, oh, okay, maybe I can help this person, or a sleeping disorder. Well, tell us a little bit about how we can. The
first thing's observation. So have a look at them.
Yes.
How are they breathing? Are they breathing with the upper chest? Are their shoulders maybe raising on the inhale? Is it noisy? Are they breathing through an open mouth? If you're answering yes to those sorts of things, then yes, have a look at their respiration rate. Is their respiration rate up? You know, like there's people getting around with 14, 16, 18 breaths per minute, which is a hyperventilation syndrome. That's not normal. So just that. And, of course, with that increased hyperventilation, if you like, blowing off carbon dioxide, okay, they're going to shift to a sympathetic tone. And today, more than ever, I think it's important that we can down-regulate from that. And we can do it with our breathing very, very simply, and to down-regulate, because I think a lot of people, probably myself included, we're going around, it's like having the gas on just a little bit of flame. Then you get on the Monash Freeway, getting to an appointment in the morning, and it comes to a grinding halt. So the flame gets turned up, okay? We're in a more sympathetic tone. So I think a lot of that's going on, and people don't have the knowledge to down-regulate, which we can do and which we will talk about.
Well, tell us what a good breathing pattern is. What should we be aiming for?
Possibly the opposite of that, I would have thought. Big thing in anything you do, obviously, is awareness.
Mm-hmm.
If you don't know, if you can't tune into what you're doing, you'll never pick up on it.
Mm.
So you've got to check in on your breathing regularly from time to time, particularly if you're getting some tools to use to allow you to down-regulate to get to a better functional breathing pattern. You've got to be aware of what you're doing. So awareness would be the first thing. The second thing is to breathe through your nose. Okay. Not mouth breathing, but nose breathing. And why? Because we're filtering air that's coming in. So any of the baddies that are out there in the environment, viruses, for example, contaminants, we're filtering.
Yes.
The next thing we're doing, we're humidifying.
Yes.
Okay, before we take it into our body. And probably one of the big things is we're not getting the volume of air coming in, which is one of the things we need to change if people are over-breathing. We want to cut the volume down. So the nose is not a bigger passage into the body as the mouth. So if we can breathe through the nose, it provides something like a 35 to 40% resistance to incoming air as compared to the mouth. So
and why is that a good thing? That's like positive expiratory pressure. Is that providing?
No, moreover, the volume will, if you can't get as much in, your respiration rate will come down too. So remember, we want to try and drop that. So doing that,
which has a calming effect as well.
Yeah. And it seems to be, I'm not saying a physical, but there is a connection between the nose and the diaphragm. If you're starting to nose breathe, you can engage the diaphragm much more easily. And another way to do that, of course, is an upright posture. If you're hunched over, it's very, very difficult to engage your diaphragm to breathe. And people will talk about, you've got to belly breathe. Well, belly breathe is probably pushing people down the wrong path, because if you think about it, I cannot take a breath, but I can move my belly in and out.
Yes.
Right?
Yes.
What I prefer to say to people is breathe through your nose and try and expand your lower ribs. So if you were to put your arms or hands on the outer part of your ribs, lower down, and just try and move those out when you breathe, you're certainly engaging your diaphragm.
That's an important tip.
It is. It's a good thing.
Become aware of that. I think most of us probably don't really think about this that much.
No.
You know, I had initially, before becoming aware of what your training is, I had thought of, well, breathing is something we all know how to breathe. I think we all know how to do that, don't we? Well, the answer is no, we don't.
No.
Well, we don't. We can breathe, yes, we can survive, but we're actually not doing it properly.
And we're not doing ourselves any favour by that dysfunctional breathing pattern.
There's something else you drew my attention to, which I hadn't thought about, and that is the addition of nitrous oxide from the nasal passages. Can you tell us a little bit about that?
That's, again, by nose breathing. When I do the workshops, I talk to people about the nose, and, they've got this perception that what's on the front of your face is your nose. So I talk about having a snooker ball and putting it between your eyes and pushing it inside your skull. And that is the nasal cavity. That's how big it is. All right? So in there, it generates nitric oxide. Breathe in through the nose, it's picked up, it's taken into the airways and into the lungs. Why is it good? Because it's a vasodilator and a bronchodilator. Okay, so it's going to have better gas exchange within the lung, and it's going to open up the airways as well and open up blood vessels to allow better transport. And interestingly enough, there was a cross-country running coach, I think it was in England, who had his runners drink beetroot juice. Beetroot juice has a lot of nitrates in it. So what happened, they did a study, and they would drink about 450 mils of beetroot juice every day for a week prior to competing, and yes, increased performance, better performance as a result.
I'll be doing that before my bike ride.
Yeah. So
I don't like getting overtaken on my bike.
No.
I'll be having beetroot juice for breakfast.
Yeah, just put that in your bottle.
Muesli. Oh, my bottle.
In your bottle.
Correct.
Beetroot juice.
Done.
Yeah,
Thank you.
Good. The breathing too. If someone comes in and they're sighing a lot, coughing a lot.
Yeah, like that, yes.
What they're doing is oftentimes dumping carbon dioxide, because it's got a low tolerance to carbon dioxide, so they're trying to get rid of it.
Yes.
So we want to build a tolerance to carbon dioxide with what we're doing. So if someone sighs a lot, what I tell them to do, everyone sighs, everyone yawns, but if it's more, if you like, than it should be, if they yawn, if they sigh, I tell them to hold their breath for 5 seconds. That then allows the carbon dioxide level to raise up again, right? And then if we can start to increase their tolerance to CO2, we're getting there. So we set upright posture. We want regular breathing.
Yes.
So slowing the breathing down. And again, when you slow it down, your carbon dioxide is going to raise up a little bit, and we haven't got the tolerance for it. So it's a perseverance. You may develop a little bit of air hunger when you're doing exercises. I mean formal breathing exercise, not exercise per se, but a little bit of air hunger when you're doing the exercise is fine, because that's showing that you're hitting that CO2 intolerance, and that's what we're trying to bring down. The cadence of breathing. So when we're looking at breathing, if you go to someone who teaches yoga, often they'll be doing the biomechanics. Use your diaphragm. We're doing the biomechanics. We're doing the biochemical, which is the CO2 reduction. And we're looking at the cadence of the breathing. We're trying to slow down the respiration rate. So we're looking at it from 3 pillars.
Yes, I think that respiratory rate, generally in medical school, it's taught 12 to 14 breaths per minute.
Yeah.
And you're aiming for less than that. What are you aiming for?
Tess Graham, and I've put her books in there as a book recommendation, she's aiming for 8 to 12.
Yeah.
General population, 8 to 12. Me, no, not now. If I'm dealing with athletes and people like that, 6 breaths per minute.
Yeah, it doesn't sound like much, does it? It sounds like, I'm almost having to breath hold to get down to 6. I can imagine that when I'm really calm and quiet and resting and...
Yeah, we're talking resting rate. We're not talking during exercise.
Watching Collingwood getting beaten by Hawthorn.
Yeah.
But, I probably would be, maybe, but yeah, I mean, mostly I think I would not have recognised that as the normal.
Well, if you think about it this way, I don't normally give people a count for breathing. Breathe in for 7 seconds, breathe out for 7 seconds, whatever. If they've got, and we'll talk about a Bolt score in a minute, if they've got a low Bolt score. If they've got a Bolt score that puts them in a functional range, then I would perhaps start to recommend. Now, if you think about 4 breaths in 4 seconds in and 6 seconds out, right?
That's what we should be aiming for.
That's 6 breaths per minute.
Yeah,
right? Yeah. And the other thing that ties in with that, if you want to look a bit into the background, that's having an exhale of 1.5 times the inhale. Yes. Yeah. Which is great. If I can go back to talk about the workshops, because that'll tell you what we're doing with some of the testing. So people come in, and I don't tend to see one-on-one now. I tend to do a workshop of about half a dozen people, 6 people, because you can control that. You can be a bit more individual with your prescription and all that sort of stuff. So first up, we just find a pulse. Find the pulse, feel it. Now I tell them to extend their exhale. What happens is the pulse slows down. Breathe in again, the pulse speeds up. Slow the exhale, breathe out, it'll slow down again.
Versus sympathetic.
Yeah, exactly. And heart rate variability. Now athletes, because we've got so many wearable devices now, we've got Whoop straps, we've got Aura rings, we've got Apple phones, we can measure heart rate variability. So we're training. Let's say an athlete's training, or someone who likes to monitor their exercise. They've got their heart rate variability. They wake up the next morning and it's gone off, right? That could be a rest day or a lighter workload day, right? So because you're not going to, the body won't react as well to stress when the heart rate variability is not on. In the good old days, we used to just use resting heart rate. So you take your resting heart rate at the moment you woke up in the morning, it would be whatever it was. It could be 54 beats per minute, say, resting heart rate after sleep. If it had gone up 6 beats, we'll go, okay, we're overtraining. So the next day, that day, we would lighten off the load or not train, do something alternative, go for a walk or whatever it was, and then get back on track. So, yeah, so...
Well, we've talked about the reason for breathing through the nose.
Oh, yes, back to the workshop, Luke.
Yes.
Haven't finished,
no,
yes.
Let's talk about that
because that decreasing the exhale, lengthening the exhale is really, really good. If someone, for example, is going into a stressful situation, right?
Yeah. Public speaking,
interview,
or
whatever, exam,
yes,
operation,
yes,
whatever it happens to be.
Competition of any kind, yeah.
Competition. If you breathe through your nose, slow down the exhale, you're shifting into a parasympathetic tone, rest and digest, right? And it works.
Yeah, it does.
And it's simple.
Yeah.
So simple.
Yeah. Well, a lot of us just... We're over-breathing.
Or take a big breath, calm down.
Agitated. Yeah, calm down.
Take a big breath.
Yes.
Wrong.
Nasal is a short breath through the nose.
Breathe lightly through your nose. And extend your exhale.
Yes.
You'll go quiet.
6 seconds out. Even a bit more.
You don't even have to count it. Just breathe in through your nose and extend your exhale.
That's very important to recall.
Yeah.
I did a recent training camp trying to learn how to foil, and we had Trevor Hendy there.
Oh, yeah.
And Trevor was talking exactly about this, and hit the water, waves around, whatever. Just remember, breathe slowly. Just calm yourself, don't panic. It's just a few bull sharks in the river, nothing to worry about. It was actually very, very helpful. And this is what you're talking about. And that's one of the things you're teaching in your workshops.
The other thing we do at the workshop is get the pulse oximeter. Yeah. No, sorry, we're not going to do that first. Let's talk about the Bolt score.
Well, can I ask you a bit? I think the idea, you had a little acronym. Can I just review this very briefly? Yeah. Like you've got the nose.
We'll get to that.
You want to come to that in a moment? Okay,
yeah,
we'll come to that.
Yep.
Okay, yep.
We'll try and build it in.
Good.
Yep.
Bolt score.
Yep.
Let's not run ahead.
Don't take a tangent.
This is not that you're saying Bolt score. It's just the Bolt score.
Exactly.
Right.
Yeah.
What does it stand for?
Blood oxygen level test.
Thank you.
Why it's called that, I've got no idea. Patrick, in his Oxygen Advantage, we do the Bolt. Exactly the same thing in Buteyko is called a controlled pause.
Yes.
So a CP and a Bolt are exactly the same thing.
How does it work?
It's measuring your tolerance to CO2. It's not, and you've got to stress it with people, it's not how long you can hold your breath, but it's measured in seconds. So through the nose, it's the breath in, breath out. Pinch your nose and wait, counting in seconds until the first indication that you'd like to breathe. So that might be a flutter around the abdomen, the lower chest. It might be a feeling you get in your throat.
Yeah.
Or it might be just a cognitive trigger that says, let's have a breath.
That's a normal breath in
and a
normal breath out.
Yes.
Not a huge,
no.
I'm going to take a massive breath in, hyperventilate beforehand.
No.
Okay. Normally,
it's your normal breathing pattern.
Yeah.
Breath in, breath out, pinch your nose.
And what are we aiming for?
Measure in seconds. Okay. Again, on some of the Zoom meetups we have, these guys that train Olympic athletes, they have a Bolt score of 15, right? So they're breathing suboptimally, if you like.
That's not considered to be particularly good.
That's not good. 20, we want to get up.
20 seconds.
20 seconds. 25 seconds is getting to functional sort of range, right? That's where you can do your day-to-day nasal breathing, whatever you're doing, walking around, a little bit of general exercise, that sort of stuff. We want to push it up from there. We want to get up 30, gold standard 40 seconds.
That's a long time.
It is, because it's not breath holding. It's when you first get that desire to breathe. So it is a long time. So what you have to do is we do certain exercises to improve the number of seconds that it takes before you get that. So improve your Bolt score. Someone going from 15 to 20, you may pick up 1 to 2 seconds per week doing the exercises. I was going to come to later to talk about why people often don't go ahead and continue, is that there is time, it's time it takes to do it. It's not a pill you can take and it happens straight away. So you give people the exercises, you say, this is what you're going to do, and you've got to do it for about 60 minutes a day. And people will go, take a breath in, right? 60 minutes a day.
That's quite a lot of time to
It's a lot of time, but then you clarify it. You've got to breathe anyway. through the day. So why not make 60 minutes of it good and functional and get the benefit?
Could be on a train, or could be somewhere.
Train, watching telly, driving the car, whatever.
Yeah.
Easy to get up 60 minutes. Easy.
The quietest room in the office?
Yeah.
Bathroom?
Yeah, whatever. Yeah. Sitting, talking to people. As you're listening, you can be doing your correct breathing pattern.
Yeah.
Okay, so then we get to 20 seconds, we might get a stall, and it might take a week, 10 days, maybe a bit extra, to then move up to, to get going towards 25. So, and there was this bloke who coached Michael Jordan and all the top basketball players in America. And I say Woden, W-O-O-D-E-N, John Woden. I think that's how you say it. He's an older fellow now, retired. But he used to say to those sort of guys, we're going to do this to get this outcome, but you've got to want it. Got to want it. If you don't want it, it's not going to happen. Same thing happens with breathing. You've got to want it. If you don't, you're not going to get there.
Well, all changes require a certain degree of determination, don't they? Yeah. Whether you want to get good at anything.
Yeah.
Why?
But you do see the benefits quite quickly.
Well, explain to us, we're trying to increase our Volt score. And what is that really doing? It's increasing
building
our CO2
your tolerance. Yeah.
And why is that?
Well, that's important because breathing is driven by CO2 levels in the blood, okay? Breathing centre in the brain, you could say it's a bit like a thermostat. I know thermostat measures temperature, but I'm talking about dialing up and dialing down. If you've got a poor tolerance for CO2, your dial's turned up for CO2, right? And as soon as the level comes up, you want to get rid of it. Sigh, whatever, get rid of it. Breathe more heavily, keep it down, unload it all the time. But what we want to do is to turn the dial down so our tolerance to CO2 improves, okay? So CO2 is driving our breathing, pH of blood as well, but basically the CO2 level.
And why is that a good thing?
Because it allows us to breathe lighter, slower and deeper. The other thing it does, jumping around a little bit, but hopefully I'll cover everything. Yeah. CO2 is important, right? It's not a waste gas. People say, take a big breath in through your mouth and get in as much oxygen as you can. Well, if we put a pulse oximeter on someone and we measure their SpO2, the saturation of oxygen in the blood, they'll measure anywhere from 95, 96 to 98. Fully saturated, that is. That's what we call it, fully saturated. So if you take a big breath in to get more oxygen, you can't get any more. It's fully saturated anyway. You can't get any more in there.
Yeah.
So there's the first wrong instruction, big breath in to get more oxygen. The second one is breathe out hard, get rid of that carbon dioxide. Another fairly poor instruction, and the reason being of the Bohr effect, B-O-H-R, which basically says you must have a certain level of carbon dioxide in your blood to unload oxygen from the red blood cell, from the hemoglobin in there, to tissue. If you haven't got enough carbon dioxide, it's not going to unload the oxygen. So by having a poor tolerance to CO2, you're blowing it off all the time, you're not carrying it in your blood, so therefore you don't get that opportunity of when the blood's circulating and you're increasing your exercise to unload the oxygen at the level of the working tissues or organs that need it.
Yes.
So that's why we want to be able to tolerate
high CO2. Yeah. I think when people are told, take a deep breath in, it's almost the implication is that maybe the lungs haven't fully filled up. The lungs are this reservoir. You're going to fill all the alveoli up with air. So, I mean, I'm not sure that's part of the implication, I think, of that very deep breath. Really take a deep breath in, you're trying to fill up your lungs entirely. There's that sponge full of air.
Yeah, well, big breath to people often doesn't mean deep breath. It means, and you can do that by sucking in air and raising your shoulders.
A gasp into the back of your mouth, not necessarily actually deep in your lungs because they're not using the diaphragm.
Yeah.
The
other thing, if we jump around a bit more and we get to the diaphragm, I wish I'd known 30 odd years ago when working in the clinics and all that stuff with musculoskeletal stuff, we used to train the core all the time. And one misnomer that people had was your core is your abdominals. So get the six-pack, get that strengthened. But that's only one part of it, right? We've got the anterior part, which is the abdominals. You've got the posterior part around the spine, multifidus, that sort of stuff. We've got the pelvic floor at the bottom, and we've got the diaphragm at the top. So we've basically got this cylinder of muscle.
Yeah.
Okay. Nothing is going to work properly for you if you haven't got a strong core, a strong base to work from.
Yes.
So all your functional movement has to work off a strong core.
Yeah.
Otherwise, your movement becomes dysfunctional.
Yeah.
Right?
Yeah.
If you think about the race car, you can put the biggest engine you like in it, but if it's not stable, it can't get to speed. It can't corner. It can't do anything.
Yeah.
So for us, we're the same. We want to have this stability to work off. The other interesting thing about the more you use the diaphragm for breathing, and we can load it even more to put it under more stress with things like training masks or something like that, it will get thicker, it will get stronger. Its attachment around and to the spine, it provides stability for the lumbar spine. And another statistic I came across was 50% of people with low back pain have a breathing pattern disorder, which I found interesting.
That is very interesting.
Yeah.
Again, it certainly isn't something which we teach or think about much in hospital or clinical scenarios, but and I think a lot of people really don't focus, and I'm one of them, on diaphragmatic breathing. And yes, you want to have and you've got this, Allan, you've got a cage of muscle. You have done it. Like,
the other thing,
strong diaphragm, anterior, posterior, and pelvic floor. It's all got to be strong.
Yeah, and we think about the muscle itself for providing the stability, but it's not only that. When we inhale, the diaphragm moves downwards. It's in a dome as it's sitting resting.
Yes.
You breathe in, it moves downwards. What we're getting is we're getting an increase in intra-abdominal pressure.
Yes.
So we're getting that solidness in around the abdomen as well, which provides that core.
Yeah.
Yeah.
So we've got to be focused on the diaphragmatic breathing, recognising what the core does. We've got this idea of increasing our CO2 tolerance because that helps to dump oxygen where it's required in the tissues, and that requires us to develop that tolerance. We're going to breathe through the nose, lightly, slowly.
Yes.
6 to 8 times, maybe in a minute.
Yeah. That will come down with training. You don't have to specifically try to achieve that. Yeah. It will start to come down.
6 to 8 times a minute. 4 seconds in.
No, I'm not giving any cadence call.
Oh, well, I'm going to mention this.
Okay. Yeah.
6 seconds.
Yeah. I mean,
about that.
Would you like me to jump again?
Oh, no. And we're going to breathe and deeply. Yeah. These are NLSD, nose, light, slow, deep. This is something you've stressed before in your training. Very, very important. I do hope you've enjoyed the conversation with Allan Abbott as much as I have. Thank you for joining me. Allan Abbott's contact details are listed below, and I'm sure he'd be happy to hear from you. And during the podcast series, we will be covering a wide range of topics across many specialty interests. The discussions are not intended as specific medical advice for patients, but as a general information only and reflect the opinions of the guests interviewed. Requests for new topics to be reviewed and comments about the conversation you've listened to are welcomed and may be emailed to manager@gihealth.com.au.